My name is Kim, and I'm known as the Blanket Angel. My dad, when he first became ill, he became ill of Agent Orange from Vietnam. And his cancer had started off in his colon, which then had metastasized throughout his body. When my dad was going through his chemo and all of the rough times that he was doing, he was having a hard time even staying warm, able to do pretty much anything. The blankets that they did, they had like more of the balls on top. They were harder, more stiff kind of blanketing and stuff. Even the blankets that my mom had at home, even on the bed, it was still very tender. His skin was. And then so the blanket, the whole thing with the blanket was to be able to cover him up from head to toe to where he would stop shivering.
Through my experience, Kim Blanchett came to me, and I didn't know that she had been touched so deeply with cancer. And she came to me one day and said, Angel, she said, my dad fought cancer, I guess it was 5 years ago. And she said we would come into the infusion center and it would be cold, and he was just uncomfortable getting his infusions daily. And one day I decided to make him a blanket.
My name is Kathy Wilson, and I am a cancer victim. And I've had cancer for about 2 years. And this blanket means very much to me because it was, I got the first one on their first raffle that here at the office. And it was a very comforting thing, having gone through chemo, to be able to have something that was warm and soft and just reminded me of all the lovely ladies that work here in the infusion center. And I really, really appreciate my blanket. I use it a lot at home. It's so comforting to just lie down on the couch and throw it over me or on my bed. Just really, really appreciate it.
Okay, these are the actual cancer blankets that we give to the patients, and it's just the right size to where you can be able to lay back when you're in getting your chemo, and it covers each side of your body, on each side of it, so that at least they feel the warmth all the way through. Some of the patients actually will put it around their shoulders and heat up. It depends on where they're cold at, but because of this is the material, this is the, it's furry fleece. This is the second kind. I started off with the longer stuff, but this is the actual furry fleece. And I just recently started adding the ribbon onto the cancer blankets. And then now my goal is to be able to cut into these. And eventually, I would love for our cancer patients to have one of these, of each of them. And that way, when they're laying back and they're going through their chemo, they can look down and you can look and see all of the loved ones that they're wrapped up in.
The overall outcome that we've seen from our patients because of these blankets is inspiring. It's nice knowing it's another thing that we can give to the patients that they love and appreciate, and it makes them feel like we love them, because we do, because they're part of our family once they walk in through the door.
With the blankets, I think it's an all-around kind of, wrapped up in love type thing, because it is. Actually, if you think about it, it really is. You have a blanket that somebody put the love and attention and everything into it, and then they take the time to figure out, which blanket do I want? And the nurse says, hey, Kim, do this, we like this. Everybody has a hand in this. It's not just me, it's everybody. And with especially the girls down there, and guys actually, at the cancer center, incredible. I mean, they're so helpful. When you walk into that place, you can't help but smile. I mean, it's just the atmosphere that they give out. And to be a part of that makes you feel really good, because you know that it's like, yeah, they're putting smiles on everybody's faces and helping them, but you get that little bit too. And just to see the joy. Yeah.